.guam.gov.
And they also have an Instagram.
Yes.
Okay. 7:29. Let's get right back into the KUAM News Zoom room where we sanitize everything in between guests, just as a matter of protocol. So we get in Ned Elgin from Public Health's contact tracing squad, the A team of the contact tracers, and we have Dr. Ann, the territorial epidemiologist, on. Thanks, Annette. I know your ears probably were burning because we were talking a lot about the contact tracing.
Yeah, that's seems to be the hot topic these past few weeks.
It does. Good morning, Dr. Ann.
Morning.
Annette, we love in the background again. That's Fiji, right?
I'm sorry?
Your background is Fiji?
Yes.
Yeah, sweet. Let's just get right into it. We're curious about the results and the testing that has been conducted. Who's getting tested for COVID-19 this week? Who has been tested, and who's popping positive?
Well, we continue to test the identified close contacts, be it at home or work or community contacts. Then we also are testing individuals who are symptomatic. They may not know that they're exposed, or they don't believe they're exposed, but they are exhibiting symptoms. And so based on recommendation to go and be checked. And again, some of these individuals too are trying to rule out, is it flu or is it COVID? So we are, wanting individuals who are exhibiting symptoms to seek medical care. Don't wait, especially if it's getting worse, to, seek medical guidance and evaluation, and they can determine whether, to give you both the flu test and the COVID test. And then again, we were planning to have a community-based testing tomorrow, weather permitting. And so that is open to the public. However, as JIC announced the other day, it's actually already closed to others because of limit of 200 people, and that's open to whoever pre-registered through the UMATIC Mayor's office.
Can we just go back into the testing that was done by Public Health Lab this week, and I guess for the last few weeks, has been testing that's coming from identified close contacts with positive cases. But are you able to tell us, and I know the HIPAA and all that, but more specifically, where these cases are coming from? Is it from community spread? I know that we had seen a construction barracks with it was like 50-some positive.
He said it was a significant cluster.
Right. And then we're also hearing things about, I got a lot of friends who go over at Victory Chapel, and they're telling me that they had a large number of people from that church test positive, but we haven't heard any information from you guys about that.
Well, we've been testing any and all identified contacts, be it at home or at work or community. And again, our naming of establishment was something that we've worked to improve on, because again, there's been a lot of concern about, well, if we out people, we're causing them to be blacklisted and shaming them. And that's not the case. When establishments are collaborating with us and working with us, they're helping us to identify close contacts. We work with that, and we want to continue that partnership. We don't want to have doors closed on us when we need their assistance. And so, again, the identified people are notified of their exposure. We work with them to make sure they're quarantined, and if they need testing. And so, be it a religious group, a private company, or at the home. And that's what we're seeing. There's a lot of household contacts who, to be expected, are becoming positive because they're at higher risk. They're at home in close quarters, their hours of exposure to each other. And so unfortunately, a lot of our contacts are household members. And then, we're seeing that where, okay, these people didn't know they were exposed, that they're positive. They go to their respective work, and then now we're dealing with their coworkers. And so, for us to name every establishment, organization, I know I said it in a previous interview with y'all.
Right.
Act like it's everywhere. Assume anyone is positive, and just to take the necessary precautions.
Yeah. I just think some people may think that's not right, because we do out people that have like rat infestations and things like that, or when the Division of Environmental Health goes out and does their COVID-19 inspections, and they say areas like what church was it?
Right.
Calgary, one of those churches that they had people not wearing masks, they weren't abiding by social distancing, etc. So
It's a little
I just
inconsistent.
just kind of
Right, and we're working on that, and this is the issue I would like people to understand is just because an establishment has a positive case, it doesn't mean it was because of that establishment. It could have been that the person was exposed at home or at a party or something outside of the establishment,
Yeah.
and that just happens to be their occupation and where
Yeah.
they work. So that's why we have to be very careful if we want to out someone. And again, that's something that we sought legal counsel from, and that's something that our department is working on to have a policy moving forward that, okay, if there's a large cluster or if the establishment or organization is uncooperative, then that's maybe, we're going to put your name out there because you're not helping us identify the contacts who public health needs to identify and let them know that they've possibly been exposed, to quarantine and to coordinate testing. So that's what our policy that we are putting in black and white, thanks to the legal counsel guidance that we received moving forward. And again, so that's where, we've had numerous rumors, people calling in saying, you know what, this business has a case, oh, these over here, and to find out they didn't. And so can you imagine if we named those establishments and it was a false rumor? And again, so we always have to do our background check. A lot of our investigations too are preliminary. People are calling us before we even have the results, and that's what we need to verify, because public health will only act on verified, accurate information.
Of course.
And so that's where we're trying to balance, all these false rumors going out there, naming businesses and everything, and to find out, no, they didn't have a case.
Right. But on that note, I just feel like it reaches a point where if, and I understand if the businesses are being helpful or whatever, but just from a transparency standpoint, I feel like if a construction company has more than 50 positives, then we deserve to know what construction company it is. I feel like if a church has, dozens of positive cases, and I feel like we just need to know. I mean, we saw it early on. You guys outed Iglesia de Cristo. We outed Calvary Chapel most recently. So yeah, I get that. You don't want to tell us everything, and you can't. But at the same time, I'm not saying if a business has one positive or if a church has two positives, then we need to know. I'm just saying at a point where you got 50 positives in a construction barracks, and the public has a right to know. Who's the legal counsel for public health?
We've gone through the governor's office as well as through the attorney general's office for guidance.
Okay.
For any legal opinion. Yes.
Yeah. So, Bree. Hi, Dr. Ann.
Hello,
Did you catch Dr. Uggin's interview?
Dr. Howen.
Dr. Jolene Uggan. She came on earlier this week.
No, I didn't. I was driving.
Right. She had talked about the second wave, and we kind of touched base on this in our last interview. But she had said that it appears to her that this second wave and the, for lack of a better word, the potency of the virus in this second go around, it's a lot more alarming the first time. She's saying that we have patients who are really, really sick in the Guam Memorial Hospital. From just, I guess, an epidemiologist standpoint, what can you say about that? Are we getting it worse the second time around, or is it just more widespread?
Okay, the issue the second time around is there's a lot more cases of local transmission. And what we're seeing is that 84% of the deaths, total deaths, we've had 30, 84% have occurred in the past 6.5 weeks. It's because of this surge and the sheer numbers. You can go on our dashboard and look at the actual numbers. We've seen, I don't know the exact percentage but you can see it on the graph. It's because of the sheer numbers of cases and local transmission, all these large gatherings and so on. And so, yes, we have a whole bunch of susceptible people who are older, people with underlying medical conditions, and they end up in the hospital and they might be there for weeks. And then, there's a lag time maybe from when they were infected until when they die. But we certainly don't want to see the deaths, because these are like innocent bystanders, elderly people who are sick, kids with neurodevelopmental disabilities, etc., people with chronic diseases. It's just, the result of this surge, the sheer numbers from opening up and people not playing by the rules, large gatherings. And yes, we're still investigating. And going back to the issue of 50 positives at a barracks, does it really matter as long as they're all confined to the barracks and they're not going anywhere till they get better? You know, that's what they're doing in the States. They're saying, no, if we have a college dorm full of sick kids, we have a COVID dorm and we put them there. We don't send them home to infect their families. So there are mitigation practices for those kinds of situations. And
But
I'm
if
sure
it
they're
doesn't
following
matter,
it.
then why can't people know?
I'm not in charge of naming of names. We're having discussions about that and trying to develop a policy if it's a certain number of cases where, again, Chris just talked about, he said if it's 1 or 2 at a workplace, do we really need to know? Probably not. If it's 5 or more, we're still developing a policy on that.
Right. And that, without getting into specifics or violating the all sacred HIPAA, what can you tell us specifically about the things that you're hearing with the spread of this virus, just to kind of clue people in, even after 6 months under this lockdown, clue people in, give them more information and arm them with some truth about how this virus is getting spread from what you and your team are hearing when you do your contact trace investigations. Because we had a nurse yesterday, Alexa, I mean, she shared a meal with someone, something as innocent as that. So again, I think it's important for people to know how this virus is being spread so they can kind of take that information with them throughout the day.
It's spread through the air. It's airborne respiratory, and so that's why the challenging thing about this virus, it's new, and also we're seeing a lot of people who are asymptomatic, who are they feel perfectly fine. They don't know they're exposed. They don't think they have COVID. They have no signs or symptoms of being sick, and so they're going around, be it at work, going out, the parties, the gatherings, the restaurants when we were open in Peak or 3, and so going back to they're not wearing their mask. They're not practicing the 6 feet spacing. And so they're spreading it unknowingly. And then there's individuals who know they're sick, they have symptoms, but they're still going out. And so again, it's the social distancing, the wearing the mask, washing your hands. And so again, it goes back to, it's here on Guam. It's communities, it's spread through the community. It's here, it's local transmission. So act as if anybody is sick, even if they don't look sick. Stay home if you're sick. And practice the social distancing measures, the infection control measures, so that we can help prevent the further spread and prevent those individuals with weakened immune system or the elderly to be exposed. Because again, we've seen that too, as Dr. Ann mentioned, it's the dorms back in the States, the college. So we have a lot of younger, healthy people going out, doing their normal day-to-day work or partying or, eating out or get-togethers, and then bringing it home to a family member who is either elderly or has a medical condition. And then they're the ones who are dealing with the complications. And so again, it's here on Guam. Assume anywhere you can get it and just practice the necessary precautions of social distancing, wearing your mask, staying home if you're sick, and washing your hands.
And that,
You want the statistics?
Yeah.
65% are symptomatic of the cases. So that's 2/3 are symptomatic and another 1/3 asymptomatic. And in terms of the contacts, household contacts comprise 42% of the known epi-links. 46% are community contacts, 8% workplace, and only 4% healthcare. So it's in the households and the community. That's where the known contacts,
Right.
which we know about a little over half. We don't have the details on everybody yet.
And that, when we started this PCOR 1 lockdown, I remember and we always talk to you guys, the number we hear is, it takes a couple weeks for today to hit, right? But we've been in this lockdown for 4 weeks. And so when you talk about what you just said, people are eating out and they're gathering and all that stuff, are you talking about before the PCOR 1 lockdown? Or are you saying that those types of things are still happening in the middle of this stay-at-home order?
So we still hear from our investigators and contact tracers, oh yeah, we went over to our family member's house. They're not in the same household, they're family, but they went to a different house. Oh yeah, we had a little get together. So again, and I know Dr. Wen had mentioned this before and Dr. Manglania, it's really our family that is exposing each other. And again, it's hard because it's our culture, right? We're so family oriented, but a family going out to go shopping, do you really need everyone to go out and possibly be exposed? Just send the one person who can get the groceries or whatever necessities and come back home. It's get-togethers. Oh yeah, it's my relative's house right next door. We go back and forth between each other. They're not the same household, but they were exposing each other unknowingly, and so now we see two different households having COVID spread within their respective homes, and so that's what we're seeing. Unfortunately, it's the work. And that's why to out certain businesses is not correct. The businesses have really stepped up. We appreciate their support. We need their support. We couldn't do it without them. And so we've seen it where unfortunately it spread at the home. They brought it to their work unknowingly because they were perfectly fine, and they spread it to their coworkers. And then those coworkers took it to their homes and spread it within their household contacts. And so that's why it's just so hard, because both asymptomatic, you just got to act like you have it. If you're interacting with someone who's asymptomatic, act as if they may be. And then those who are symptomatic, we're hearing, oh yeah, I went to work and the person next to me was coughing just as worse as me. Both of you went to work still sick. Yet we've been saying for months, stay home if you're sick.
Right.
We've been saying for months, wear your mask, social distancing, and as much as possible, reduce the spread by complying with what we've been putting out there. And unfortunately, yes, the stay-at-home order continues to be extended week by week, because we're still seeing cases. Thankfully, the number of cases have gone down compared to last week. We're seeing our curve go down, but it's still, we're hitting double digits. And so that's something that we're working to continue to reduce the number of new cases that we are seeing.
Are they going down because there's not as many tests though?
Because it looks like the positivity rate's still pretty up there. So I'm curious, what do we pay attention to? The lower number of positives, like Bree said, we're getting 30 something. We had 100 some at some point, or do we pay attention to the test positivity rate? Because you're right, we're doing 30. We got 30 some positives, but we only tested 400 people.
Well, that is just in a combination of locations, but we're still testing throughout with all our military and private partners. We're testing the targeted high-risk individuals, and we're still encouraging those who have symptoms to go seek medical care and be tested as needed. And so we're still testing over 1,000 in a week's time. And so our numbers are going down. And so for us, it's the number of cases going down is a good sign. The concern is, again, still the overwhelming numbers that are being hospitalized, the amount of recent deaths that we've had. So that's where, again, even Dr. Melania said it before, don't look at the number of positive, look at the hospitalization rate.
Right.
Fatality rate.
And the number of deaths.
Yeah.
Because what we're really looking for is seeing a sustained decrease in the numbers. It has to be over several weeks. It can't just be, oh, it's down this week. We have to wait a week or two to really see.
Right.
So then why would we have a lockdown and a stay-home order for a week and not 2 weeks or 3 weeks or whatever how many weeks you need to be able to see the numbers or to show that it's working? It just seems that, if we were going to do the lockdown, maybe it should have been for 2 weeks, from the beginning, or 3 weeks from the beginning of this, instead of every week we're like waiting to find out if we're going to be in another lockdown and not really knowing, is this working?
It's tedious.
It is harder for the governor, and that's something that I know she looks at the PAG and public health and JMA. And so the week to week is something that it's for her, it was asked before, should we do every 2 weeks? Recommendation is let's go week by week, because we're looking at the data while we're also looking at the hospitalization information. And so that's something that to guide her on a week by week basis, so that it's as real-time accurate data that she can have, and she can make the decision. Does she need to extend another week, or can she slowly open up by the end of the following week?
And that, just going back to the positives, the contact tracing, right? So for example, the 30 some cases that we had yesterday, are those related to positive cases that you guys started investigating before the PCOR 1 lockdown, or is it all fresh? You know what I'm trying to say?
These are new. So there are some that it's a continuation from before PCOR 1 Then unfortunately, it's gone from one family member. Then the following week, it's another family member who started to be symptomatic. And so you have a mix of both brand new cases, or they've been linked to previous cases for more than a week to 2 weeks.
And some get tested at the hospital. They're sick. They go into the hospital. They get tested there as well. And not just GMH, GRMC,
Right.
also Navy.
How concerning is it that we're seeing more people show up at the hospital's door when they're already at death's door? You know, we've seen so many of these cases where they're getting rushed in, they're testing positive, they're dying. So, I mean, when we talk to Dr. Wen, people are waiting too long.
Yes.
Right.
Yes.
And they're not seeking care. For example, if they have a chronic condition and they just feel unwell, it's like, maybe you should go get seen, especially if you have a chronic condition or you're elderly. Maybe you should get checked out. That's a concern, not just here, it's nationwide. The people are staying at home, they're scared when maybe they should get seen, particularly people with chronic conditions and the elderly who are more vulnerable.
I'm wondering if I could just get clarification on this, and maybe if there's even a difference, because we've seen the language kind of change in the Joint Information Center releases on people that have passed away with comorbidities, and now it's people have passed away with underlying health conditions. Is there a difference?
No. An underlying condition means you have a chronic condition. Let me explain. For example, if somebody has a cardiac arrest, that's the immediate cause of death, and they also have COVID, and on top of it, diabetes, those are contributing causes of death that are also underlying conditions. I think they're just using that language. Underlying medical conditions mainly means chronic diseases, but it also can include kids with neurodevelopmental disabilities, that kind of thing.
Dr.
You
Ann,
can have acute respiratory failure, and that's your immediate cause of death. And then you have also COVID and hypertension and cardiovascular disease. So
is it interchangeable to use comorbidities and underlying health conditions?
yes.
Okay. All right. Just one. And then also, just what does this, if you could just clarify what this means, when someone comes in and they test positive during initial workup?
Well, when they go to the hospital or ER.
Initial workup? So
when they're getting checked in, basically.
Yeah, GMH
Okay.
is doing that
Yeah.
to see if anyone is positive,
Right.
because they don't want to mix the positive COVID with non-positive at the hospital. So they're trying to make sure
Right.
they're screening anyone coming in, especially if they're not a known positive. Then they need to do an initial test to determine their status for COVID.
Right. And that's anybody who comes in through the ER or is admitted to GMH. They do the, temperature check, blood pressure, all that
Yes.
COVID test. Right. Dr. Ann, you've mentioned neurocongenitive conditions twice during this interview, and I'm assuming you're alluding to one of the fatalities that we've seen. What can you share with us that you know about?
We're working on examining the data. The problem is there's always a lag before we get a death certificate, but we do know that all of them have one or more underlying conditions or chronic diseases. The main one seems to be diabetes and cardiovascular disease, and we just saw a couple death certificates with morbid obesity on it. That's not on the case listing, but it's on the death certificate. So we're going to know more once we get all the death certificates, but we do know older age, underlying conditions contribute to the risk for severe outcomes and death. And that's, again, back to the 84% of our deaths have occurred in the past 6 weeks because of the surge. So we're back to the same issue of we need to protect people. These are innocent bystanders, elderly people, people with chronic conditions.
Doc, you're talking about the elderly, right? But we had the death of a 10-year-old boy over the weekend, brought to Naval Hospital. What can you tell us about that?
Yes, there's been a few cases that are under age 50, but the vast majority are over age 50.
What can you tell us about the 10-year-old boy?
I don't have the details right now, but I think he had underlying conditions, including asthma, I believe. So lung diseases are also more a risk, but I haven't really seen that. I thought we'd see more smokers people with COPD, but it's mostly diabetes, cardiovascular disease, and obesity. Those are the main risks for severe outcomes and death. Morbid obesity.
Wow.
And those are related to diabetes. Yes.
Yeah.
That's nationwide.
Annette and Dr. Ann, so when we talk about diabetes, that's the first comorbidity you threw out. We've heard a lot about targeted testing of dialysis patients. Is that going to happen?
Yes.
Where are we at with that?
Well, that's part of the targeted testing, but right now it also depends on the establishment and their infection control policies. We haven't really seen any, except there was a case earlier in March or April that might have been associated with I forget. It wasn't the dialysis center per se. It was someone I don't know if it was a healthcare worker. Annette might remember the details on that, but there are plans to do serial testing of healthcare workers and the dialysis centers, and serology testing when we start rolling that out as well. I'd love to test every single healthcare worker with a serology test, because many of them have been positive, but a lot have not. And it might be that they have the antibodies. So we don't know. Dentists, that was Stephanie's idea. We'd like to test the dentists, see if they have antibodies. And we're planning to do targeted testing of first responders as well for serology.
When are you guys looking to start that?
Probably next month. We're still trying to roll it out, but we have the tests and they are validating it. And that's planned hopefully next month.
Okay.
And that's just for surveillance. It doesn't give us any results if somebody's infected. It just tells us if people have the antibodies to SARS-CoV-2, the virus that causes COVID-19.
Just I guess for Annette, how robust is the contact tracing team or contact tracing efforts?
We continue to grow over the course of this outbreak response. In the beginning, we had a team of 6 investigators and 6 contact tracers, all within the Department of Public Health, and specifically in our Bureau of Communicable Disease Control. Then in about May, we grew by pulling from other areas in our division as well as our department. And now we have approximately 20 investigators, and then we have about 24 contact tracers. And this is across public health. We have DYA support as well. And then we've had other agencies like GPA, Port Authority of Guam, and I've been remiss in stating GMH. From the beginning, GMH2 has stepped up to help with contact tracing within their agency. And so they've stepped up and taken care and helped us with contact tracing. So that's GMH. And then now we've had that course with UOG, with the UC San Francisco that came. There were approximately 85 individuals who took the course. And so now we're working with UOG to discuss how we can do like a pilot project with them, take some individuals from that training and stand them up as a contact tracing team to help augment us here at the department. And so that we've had other individuals who've taken the course online, and they're standing by if needed to be pulled in, or they help on as needed basis. And then we've had several volunteers offering their assistance, and so the pool is growing, and so that's something that we appreciate everyone's support, both within the government and our external partners. And then Department of Labor too is pushing. There was that announcement a few days ago that they're trying to hire individuals for assistance for contact tracing. And so that's something that we've been working with them over the past few months to continue to add to our team.
Okay. Did you have anything else? No. Okay. Well, I guess we're pretty much done here. But want to thank you guys for coming on. And just in case you guys aren't planning on retiring or anything, right? Or
No.
Dr. Hannah?
If only, right? If only
Not old enough to retire.
Hey, just want to make sure.
Any curveballs?
I wish.
You gotta ask, because
Wait.
Dr. Jana, that was like, wait, what?
Yeah. Wait. Okay. Let me ask. Do you want to retire? Yeah. Okay.
All right. Thank you, guys.
Yeah.
Thanks, ladies.
Okay.
Right,
Stay
thank
Get your
safe.
flu shots.
Yes.
Right on. Okay.
Everyone said, get your flu shots.
That's
Shot,
on the
shot,
to-do
shots.
list.
Take care.
All right,
Stay
take
safe.
care.
Okay, see you. Thank you. 7:59 again. Annette Uggan and Dr. Ann Pobutsky of the Department of Public Health and Social Services, where they are anticipating pneumatic testing. Bree.
Oh yeah, pneumatic testing is this weekend, but it's already capped. Well, only 200 people could get tested, and they've already reached that 200 threshold. So if you are lucky enough, or we're lucky enough to make the list, it is tomorrow.